Good morning, everyone, and welcome to the Friday, May 17th, 2019 Juvenile Justice Board meeting. If I could ask everybody to please join me in standing for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, well, I'll call the meeting to order, and I want to welcome everybody to our Juvenile Justice Board meeting for May of 2019. And as we typically do, we go around and make introductions. So if we could start right over here and just go around the table.
I'm Samantha Latimer from Phoenix House.
Rob Phillips, Chief Clinical Officer for Phoenix House.
Hi, I'm Nikki Moore from the State Attorney's Office.
Rocky Brancato from the Public Defender's Office.
Gina Justice, Court Administrator.
Good morning, Gary White with the Hillsborough County Anti-Drug Alliance.
Hi, Kurt Royka, Tampa Police Department.
Elvin Martinez Jr. with Bays, Florida.
Jennifer Cristiano with Axe.
Sarah Blumberg with DJJ.
Judy Royston with Department of Juvenile Justice.
Rob Parkinson, Hillsborough County.
Kelly Hammersley, Juvenile Justice.
April May, Department of Children and Families.
Maya Brown from Commissioner Kimberly Overman's office.
Okay, well, welcome again, everybody. I don't know if everybody's had an opportunity to review the minutes of our March meeting, but if folks have had an opportunity to look at those, I would entertain a motion to approve them or make any changes.
Motion made.
Seconded.
Motion to approve and a second. Is there any discussion? All in favor, please signify by saying aye.
Aye.
Opposed, same sign. Thank you very much. The minutes have been adopted. And just for the record, I'd like to just mention that Rhonda Rhodes contacted me and advised that Hillsborough County Children's Services is unable to attend today's meeting. But she does want to report in the last 2 months that they have served a record number of domestic violence youth in the respite program who would have otherwise gone to detention. And they've also served several domestic violence youth who were given civil citations. And if anybody needs assistance from Hillsborough County Children's Services, they can contact 813-264-3807. And also, Davia Larabors from Pace Center for Girls is away and unable to attend. And lastly, Captain Hollis with the Hillsborough County Sheriff's Office is attending a graduation ceremony this morning and will probably be here a little bit late. So with that, I think that we'll move on to board priorities. And we've had a number of developments here over the last couple of months regarding the priorities. And one of the big developments has been the institution of the Domestic Violence Civil Citation Program. And so I don't know if anybody would like to provide an update in regard to that. If not, I certainly will, but it'll be my own update, and I want to give stakeholders an opportunity to provide it if they wish. Okay, so as you all know, for a long period of time, I think the board has been discussing amending the Memorandum of Understanding for the Civil Citation Program to include the offense of domestic violence. And we've worked very closely with Hillsborough County Children's Services to provide a respite program at the Lake Magdalene facility for children who are accused of committing domestic violence within their home. And so Mrs. Blumberg, as the detention coordinator, has also been very instrumental in the logistics of working that out. And Rhonda Rhodes and Joanne Rollins have been incredibly helpful as well in establishing that program at Lake Mag. So the stakeholders have met a series of times and have amended the Memorandum of Understanding to include domestic violence, but at the same time, they also expanded the scope of the overall civil citation program to include most misdemeanors. I think that there are a few exceptions, 5 exceptions. And so not only did they have the foresight to include domestic violence with an incredible amount of intervention and wraparound service around that particular offense, but they've also expanded the Civil Citation program to over 200 misdemeanors, whereas prior we were limited to about 13, I believe. And so it's really a rather revolutionary step, in my own humble opinion, that the stakeholders have made such a significant expansion of the program. And more importantly for me is including the domestic violence cases to really provide some meaningful intervention to these children without the mark of having an arrest on their record. Now, they did exclude specifically in the Memorandum of Understanding intimate partner violence, I believe. So if you're living in a household and you're 17 and your girlfriend also resides there and the domestic violence offenses you're accused of committing against your girlfriend, then you're not eligible for a civil citation. But otherwise, if it's you and your sister fighting over a shirt that you wore to school, and when you get home, a big argument erupts because she's mad you wore your shirt, and the two of you exchange some physical contact over it, then law enforcement shows up and they can intervene with the use of a civil citation as opposed to having to arrest you. And as we all know, domestic violence arrests remain on a person's record for a long time. And so the use of the civil citation, I think, is really a revolutionary step, and I applaud all the stakeholders. Lieutenant Royka chaired that committee for us for a number of years and hung in there and exhibited a great deal of tenacity to see it through. And Ms. Justice, of course, and Ms. Morwood, the State Attorney's Office, and State Attorney Andrew Warren, our sheriff, our police chiefs, and the public defender, Julianne Holt, and Rocky were very instrumental in making all that happen. So I want to thank everybody for that. That has really been a big priority of mine. I've been doing this for a long time, and almost back to the last century, this is something that we've been talking about and working on, and I think this is going to make a huge difference in many, many lives and help a lot of families. So thank you.
Mr. Martinez.
Yes, ma'am.
I have one thing to add, and you did a great summary, but I will say, with regard to the establishment of the addendum to the existing interlocal agreement, the effective date was March 24th, and I have the statistics as to all diverted youth for first-time offenses for juvenile diversion that I'll talk about a little later, but I can say in summary, right away in April, we've already diverted 3 youth from arrest pursuant to this new addendum and the DV clause that was added.
Also, just because it's for the general good of the public, the DV program, it's not so much just for the benefit of the child to save the arrest, it's also the wraparound services that we're able to provide immediately to the family. Before they would have to wait until they get out of secure detention in order to receive those services. Now with this monumental step forward, they can immediately receive services both for the child and the family to make that family as whole as possible, as quickly as possible, which I think is really the huge benefit of the DV civil citation. So again, great summary though.
I wanted to add, many of these youth, after they stay their 14 days in Lake Mag, we are also working with DCF and Eckert on diversion services and providing continued wraparound services once they get home. So we've had, I don't know how many calls. We've had a busy month with interagency calls. Everybody just looking at the youth and the family and trying to wrap services around them for their return home.
Yeah, it really is. I probably do too much cheerleading, but again, I think that this project is a really good example of how collaboratively we all work together as a community. And just the first step in this whole process was getting the Florida network of SINS-FINS providers to amend the contract with Hillsborough County in order to allow them to serve children for domestic violence that received a civil citation. So that sounds like a real easy task, right? But let me tell you that you know, that can be a barricade for many communities just achieving that. And so we all work together in the Department of Juvenile Justice, and everybody has been really extremely valuable partners to help accomplish this. And it's a long time coming, because I can tell you the last time I served as chair of this board, Hillsborough County led the state historically, year after year, in the number of domestic violence arrests for children. And I haven't looked at those numbers in a long time, but I would venture to guess that we're probably still in the, you know, in the high top 10 or something in regard to that. And what I'm trying to say with that is that it's not that we have more children that commit domestic violence. It's just because of our population and other factors, it's going to happen. And we've put in place a meaningful intervention to really try to help break that cycle and to provide services to those children and those families so that it doesn't continue and escalate. And so thank you all again for all of your hard work. Any questions? Okay, well, we'll move on to the public awareness campaign, and I'm going to ask Denisha Wilkerson if she can help pull up the video. As you all know, we've been working on a public service campaign, and I'm going to play the video and then make some comments.
Valuables left inside of vehicles are easy targets for criminals, and a lot of these criminals are young adults and teens. They break into vehicles and steal valuables such as money, jewelry, computers, and even firearms.
We should have tried it earlier to make sure the volume was working. Yeah, well, last time at the executive committee meeting, it was a real disaster, but this is only about halfway. So, Denisha, can I ask you to do one more thing? On the bottom right there, next to the time, yeah, that icon is the speakers. Can you just unmute them?
And push it all the way up.
And push it all. There you go. And increase the volume. Okay, can we try it one more time? Take two.
Valuables left inside of vehicles are easy targets for criminals, and a lot of these criminals are young adults and teens. They break into vehicles and steal valuables such as money, jewelry, computers, and even firearms. Lock your car doors and remove all valuables. If you have information about vehicle burglaries or know of someone committing these types of crimes, call Crime Stoppers. You'll remain anonymous, and you may receive a reward up to $3,000. Call Crime Stoppers of Tampa Bay at 1-800-873-TIPS, paid by CSTF.
Okay, thank you, Denisha. So as you all know, we have identified a public service campaign as one of our priorities because going around meeting with stakeholders, which I try to do annually as board chair, one of the common themes I got was we need to do something about people not locking their car doors in their driveways because an incredible amount of the burglaries that are committed by children in our community are because people do not lock their cars. And so we've had discussions about that, and Mr. Parkinson had the foresight to connect the dots between what we were trying to do and what Crime Stoppers of Tampa Bay is trying to do. And Mr. Parkinson really led the effort there of us meeting with their board and talking about this initiative. And the fruit of that labor is a public safety announcement that you just saw that is airing on television. And I think, I don't know what impact it'll have, but hopefully folks that see that, and even if they're in the kitchen and the commercial runs and they hear it, they'll be reminded to lock their doors. And hopefully over time we can see the number of burglaries of conveyance committed in our community reduced as a result of that. And I think this is a first step. I think that there's a lot of opportunity for us to expand on that, but accomplishing this partnership with Crime Stoppers and actually getting this finished product up and running, I think is a great first step, but I think that we we can enhance the program as we move forward. But I want to thank Mr. Parkinson for his leadership and help in getting us plugged in with Crime Stoppers to make that happen.
You're very welcome. Maybe next month or the month after might be a good opportunity for us to work with the State Attorney's Office again to get the word out regarding the gun bounty program. I don't think we've had any recent press on that, but that usually generates some buzz as well, and that comes with an additional $1,000.
Sure, let's do it. So we'll put that on our list. And moving on to, is there any other discussion about the public safety awareness campaign? Okay, so moving on to the mental health court. Ms. Justice, is there anything new that you'd like to report, or would you just like to give an update briefly on the progress and how things are going with mental health court?
I understand that it's been going quite well. Chief Judge Figueroa is increasingly seeing children, in particular, being diverted to the juvenile version of the mental health court, which was just started this January. The Public Defender's Office has been very instrumental in trying to get the incompetent to proceed assessments facilitated at the courthouse at a pretty aggressive rate. There have been a number of partners in the mental health community, doctors who have been willing to come in to the courthouse and facilitate getting these assessments done back to back over the course of a full business day. And I will ask Rocky if there's anything he wants to add to that measure, because he and his office have been very instrumental in getting the job done.
No, I just think it's working very well. The doctors appreciate being able to have the clients there as a captive audience. I think before we started doing this, the perception was when we passed the child's case to get an expert appointed and get them to see the expert, that it was a voluntary type activity.
If you can, then we'd like you to go see them.
Right.
Yeah, and actually that perception sort of turned into a reality because we kept resetting their cases. And so this is adding a measure of efficiency and also providing some better services for these children in the long run. So it's an excellent model that we've developed here.
And I want to add that I also reached out to the Public Defender's Office because that perception does still apply to some of the families, even though the assessments are being facilitated into the courthouse. The assessments take place on a floor different from the mental health court, and although they can be escorted down to the floor and find their way to the assessor's office, they have to sit in the lobby and wait their turn. And we're losing some of the families at that point, not in big numbers, but we'd like to see zero losses so that we're maximizing the efforts of the doctors who have to be present. Just in case those who are here and might not know, I'll add that if the juvenile leaves, we have to pay a no-show fee. So it's a financial burden on the court to be able to make the commitment to have the doctor available. And sometimes we're making 2 doctors available for 1 child, and we have to pay both no-show fees if the appointments aren't facilitated that day. So I did speak to the Public Defender's Office, and we're going to try to incorporate another set of remedies that might minimize those, feet traveling a little too far.
Mm-hmm. Okay, any other comments? Just for the viewers at home, I just want to point out that this is, again, another really great example of the collaborative effort that we have in our community, and the leadership of the courts and the state attorney and the county and the public defender to really all collaborate and work to better serve children who have mental health challenges and also are in the delinquency system. And so transportation being a huge barrier for many families that are served in the delinquency system, just the efficiency of actually the courts organizing with the doctors to be present at the courthouse and to conduct their competency exams at the time that the child is scheduled to appear in court is something that, again, sounds real easy logistically, but as Ms. Justice mentioned, even going from one floor to the other can present challenges. So imagine if you have an appointment 3 weeks away and you have to get from Seffner to Town and Country, and it's likely not going to happen. And so the result is that we're not serving the children in that category to the best of our ability, or they're not receiving the level of intervention that's appropriate for their needs. And so innovative programs like this, and with the chief judge really presiding over the mental health court and establishing an entire division, is a really meaningful and powerful example of how we really as a community focus on better serving various populations through our court system. So thank you all for that. In our Public Service Award, we have worked on an application. As you all know, what we're going to do is in November, we're going to select one individual that works with juvenile justice populations within Hillsborough County, and we're going to honor them at our November meeting with an award, thanking them for the work that they do. And so for that to happen, we've got a subcommittee who's met, and Mr. White is heading that up, and we've come up with an application which we will provide at the executive committee in June, next month, for review. And then we hope in July we'll make it available to the community, the application, and give folks from July through September to apply and submit their nominations. And then the subcommittee will meet and we'll select an individual to be honored at the November meeting. And finally, community connections. I don't know if Ms. Cristiano has anything new to report regarding community connections.
Just a brief update. I'm not sure if everybody is aware of this, but we are looking to merge with the Harbor, which is out of Ohio. So due to that merger, we are kind of in a transition stage right now. But the hopes is that once the merger goes through, here in a few months, that we'll be able to better fund the project. So right now, we're just kind of in transition, waiting for everything to take place.
Any questions? Okay, let's move on to member updates. And Mrs. Royston, would you like to go first?
Sure. Good morning. I can do detention first. Superintendent Wilson isn't here. But for numbers for detention center, which I think this is a record low, 33 youth insecure. If you know, this is a 90-bed facility. I don't think we've ever been in the 30s. We've been around 40. We've been hanging in there, but this week was 33. 53 on home detention, 24 on EM. Our commitment wait list is 0. And then as far as prolific offenders, we have 9 youth in jail, 3 in the community, 4 in detention. Supervision numbers. For kids on supervision, we have 467 youth. 71 are in aftercare status. I think we have another new low for kids in residential programs. It's at 59. We've been running around in the 80s, but I don't think we've ever gotten down to 59. And 613 youth on intake status. For probation, we are working on the implementation of the detention risk assessment instrument that will start in July. They had a request for proposal out for supervised trackers. The return date was May 16th. So looking forward to getting this over with and everything in place. That's it, if anybody has any questions.
I heard you mention that the numbers are down at the centers. Do we know what that's correlated to? Is it civil citations? Or are they just acting better? Or
I think crime is down, but I also think we're diverting off our DV youth. I think that when we look at committing kids, we're making sure that there's wraparound services in place before we commit a youth. We still look at public safety, but if we can keep a youth in the community, that's best for him. So I know probation has substance abuse money, mental health money now that we're able to provide wraparound services. So I think it attributes to Hillsborough County and the work that is done with the state attorney's office, the services, our specialty courts. I think it's a combination of everything.
good, sounds pretty thorough. Good, thank
Any other questions for Ms. Royston? Okay, Mrs. Levine, would you like to give any updates regarding prevention?
Yeah, I'm actually going to play Pat McGee for a minute.
Okay.
Pat she's stuck in traffic on the bridge, by the way. Pat just wanted me to notify all of you about or remind you of the Bridging the Gap discussion, which is May 29th. And it's going to be held at the Marriott Waterside Hotel from 1:30 to 4 p.m. Right now, she has 10 to 12 youth, and law enforcement includes Tampa Police Department and Hillsborough County Sheriff Office, and we thank them for the collaboration. Special guests that are attending is Judge Twine Thomas, the chief, and the sheriff's office. And so we just thank you for those, the support and the collaborations. I just wanted to report on behalf of the statewide Circuit Advisory Board coordination that Monday and Tuesday we have the State Advisory Group, and Alvin is actually going to be one of my cab chairs that's going to report and be on the discussion panel for the State Advisory Group. And we have a lot of great questions talking about the strengths of this cab, which there are a lot of strengths to this cab, also talking about the challenges and also talking about the dually served youth. I'm sure that'll come up as well. And we'll be presenting that in front of the State Advisory Group on Monday and getting a lot of feedback, hopefully, and discussion about those topics and initiatives. Also, just wanted to remind you, May 29th through the 31st is the Attorney General's National Conference on Preventing Crime. That's here in Tampa, and that's a really great conference. The actual dates for the conference is May 30th and 31st. And also just wanted to let you know that we appreciate everyone that has applied and actually submitted a proposal for the RFP. I'm on the Central Region's evaluation team, and so we're in the process of evaluating these RFPs, the proposals, and just wanted to thank everybody that has applied for that. So thank you.
Any questions for Mrs. Levine?
Excuse me, what day is Bridging the Gap?
Bridging the Gap is May 29th.
Thank you.
1:30 to 4.
Thank you.
And I have a notice for it that I'll forward out to everybody.
Thank you.
Okay, Mrs. Blumberg, would you like to give an update on JDAI and Red?
Sure, absolutely. Good morning, everyone. I am very glad to be back. Don't get pneumonia, that's all I can do about that. We are, right now, in JDAI, we are focused on the DRE and the supervised release continuum that will be implemented as part of the DRE. Judy and I have been working as a team. She's been working on the end of the screeners and the home detention side. I've been working on getting the ERCs developed. The ERC stands for Evening Reporting Center, and that basically is a place for youth to go after school where they will be supervised and monitored, have some mentoring. There's a lot kind of that goes on behind the scenes, but Hillsborough Safe and Sound and Freddie Barton have generously volunteered to take on the task of opening the ERC at the Kings Forest Recreation Center. There is a meeting today with some of the stakeholders at 1 o'clock at Kings Forest. If any of you would like to attend, it's open to the public, and we'll be talking more in depth about that. We have not had a Red Committee recently, and we had some hurdles in February and March. So we will be trying to pull that back together as soon as possible. Finally, I only got permission to kind of make this announcement this morning, but I am leaving DJJ. This is my final board meeting as JDAI coordinator. But you will see me around. I will be here, and I can discuss that with you all privately. But yes, today is my last meeting as a DJJ employee. And thank you very much. I've learned so much from all of you. I knew nothing when when I came into this position. I was a JPO. I knew how to take care of direct line issues, and you all have been just an amazing opportunity for me to grow in my and actually to identify where my passion lies for my professional future. So thank you very much.
I do have a question.
Mr. Benjamin, would you mind just coming up to the podium, sir?
Sorry about that.
That's
Good
okay.
morning. I just have a question as far as the changeover, the reporting process for the new system that will be coming online in July. Is that going to be like a daily monitoring? Or, I guess I'm not sure how the position will be classified, but that person would be basically monitoring that youth, in terms of their daily activity. I guess I'm a little bit new to that. I'm just trying to see how the tracking system would work.
The tracking
So
as far
trackers, if a youth, when a youth gets arrested, he goes to the JAC.
Right.
They will have the scoring instrument.
Right.
They determine if he's a public safety risk and if risk for going to court,
Right.
he will stay insecure. Other youth will have points that are
Right.
12 or below. The Evening Reporting Center is one of those.
Okay.
Supervised trackers will be seeing kids out in the community. It's for
Okay.
21 days. So there will be kids out that need contacts 3 times a week that have, are on intensive home detention. There are kids that are on intensive home detention with electronic monitoring.
Right.
So the department put out a proposal
Right.
for trackers, and it closed on the 16th, and they will strictly be doing surveillance.
Okay,
It's
I
not
got you.
about, they can recommend treatment services, but
Right.
it's strictly to make sure they're in place after school, after
Right.
work. They don't leave their home. They're only allowed to go to church, doctor's appointments, and any type of treatment.
Right.
So, and to ensure that they make it to their next court date.
Okay.
If they don't, or if they violate, then there's a detention review the next day.
Right.
And the judge then determines whether they need to be escalated, de-escalated, put back in secure detention.
Okay.
So it's, while they're awaiting their court date, it's a 21-day period.
Right.
And it's surveillance contacts, no other type of treatment services.
Okay. I just was wondering how that process was going to work, because I know it's a little, DJJ has been working on it for a while, but I guess the rollout is for those of us that's in that side of the business, kind of want to see how that works, and if it can help, well, either way, we'll still maintain our numbers in terms of that, but we'll see how that works out. Thank you.
You're welcome.
Just to add, thank you for posing that question, because part of what I forgot to say was that with the new DRE, everything will be reported in real time to headquarters. So, and that includes DV, any detentions for domestic violence. The way it works now is we get a report the month after. So, like we're just getting March's report now. So this will all be in real time. The scores will be in real time. The judges who had the case and detention hearings will be in real time. So it's going to give us a much better way to track how the DRE is working from day one. So.
And not to bore everybody to death, but the detention risk assessment instrument is really a logical next step for the reforms that have taken place in the Department of Juvenile Justice and the way that we serve children on the delinquency side of things in the state of Florida. So over the last 8 years, the department rolled out the roadmap to system excellence, which has resulted in a lot of the initiatives that we have in place today: civil citations, domestic violence, civil citations, and the overall arching kind of theory behind that, based in research and evidence from years of studies, is that large majority of the children that enter the system do not pose a significant risk to reoffend, right? And so what the system has been designed to do is to kind of take those children and divert them into community-based services and civil citations and that type of thing, reserving the delinquency system and the intensive high-cost resources to the smaller population of children who pose a greater risk to public safety and a greater risk to reoffend. So with the detention risk assessment instrument, they've created a new risk assessment tool that's been validated that can essentially predict a child's risk to reoffend. And so the theory here is to create a continuum of detention services, so to speak, where the same principle applies. The low-risk youth would be in a lower category of home detention, minimal contact. The next step up is an evening reporting center, and the evening reporting center, which Safe and Sound has stepped up to as a great partner to provide this service for our community, is those children pose a greater risk to public safety, but they also have a higher need for intervention and for services, right? So they'll be engaged in a community-based reporting center where they can get help with schoolwork and tutoring and skills building and that type of thing. Then the next three levels are for the children who are deemed to pose a higher risk to public safety or to fail to appear for a future court appearance, right? So you have the intensive home detention, which is going to be more frequent contact by the trackers, and intensive home detention with electronic monitoring, which those children, obviously, if they violate that, there's an alarm that goes off on the monitoring system and a quick response, hopefully by everybody, so that they can't commit a new crime while they're awaiting a filing decision or a court hearing. And then obviously you have the secure detention. And those services, the secure detention, which we heard are in the 30s today, but these are children who are deemed to pose a risk to public safety, right? We've gotten to the point now where we have 30 children in detention. But detention should be, in my opinion, reserved for the children who pose a significant risk to public safety, right? And they're held in a secure facility. And with all the JDAI efforts and everything that we've put in place, we're able to serve the children who are lower risk. Not to say that they're all going to behave properly and be perfect little angels, but we can better serve those children in the community without exposing them to an institutional type setting. And that's over the overall theory behind the new risk assessment and continuum of detention services.
Well, Sarah, hate to see you leave. It's been a pleasure working with you and having you as part of this team. Your role as the coordinator, you've done an outstanding job for us in the community as well. Your tenacity in getting some of these projects through has not gone unnoticed, and we will miss you being a part of this group. And so we hope that you do well in your future ventures. I'm sure you will. But thank you for your commitment to this board and to the youth of our county. Thank you so much.
Thank you very much, Lieutenant. And I will be around. I'm like a bad penny. I always turn up. So you haven't seen the last of me, but thank you very, very much. It's been my pleasure to work with such a great collaboration and have the support of all of you to push some of those programs forward. So thank you very much.
We look forward to continue working with you in your new capacity. Okay, Rocky, do you have anything new to report regarding Safe and Sound?
I know that the summit was just had, the Safe Summit. I had to be at my sister's wedding, so maybe Ms. Justice or someone can report on that. I heard that it went well, but...
My son had a baseball tournament, so I wasn't there either. But the chief judge did represent the court in a panel that afternoon that was a robust community partnership. Was there anybody here who was present?
Yes, because I'm pretty sure it'll be found out if I didn't say anything.
Yes.
I was there. I know how this works. But no, I was only there for a part of it. And I did get a chance to talk to the chief judge afterwards. And so there were a number of parents and students that were there at Middleton High School. And it was, I think, one of the observations, and they did have some breakout sessions, so there was some good capacity building. There were some good awards also. There were some young people that were recognized for all the work that they've done. So that was a really good part, and of course for those students that are going on to college. One of the things that that the chief judge and I did discuss a little bit was about how could we get more parents, and for some of the important things that some of the discussions that were there. So we're looking. I'm pretty sure Freddie Barton and Safe and Sound and all the team are looking for that. So it was good. I'm pretty sure it's going to be even better next year.
Excellent. Okay, we'll move on to civil citations. And Ms. Justice or Ms. Boatwright, would you care to give an update?
I'll defer to Yvette if she'd like to get up and talk.
Good morning.
Good morning. For the month of April, our program received 63 referrals for civil citations. 34 were from schools and 29 were from the community. Of those 63 referrals, 5 are still open. 5 have been closed out unsuccessfully. They were closed out unsuccessfully for a number of reasons, to include parents not wanting the children to participate. One youth was referred for a higher level of supervision, and a couple of children, when they came into the office, they pled not guilty. As Ms. Justice mentioned earlier, since the addendum, that March 28th addendum, our program has been able to serve 3 battery domestic violence cases. We also received 28 possession of marijuana charges for the month of April and 19 petty theft. In terms of the gender, we had 33 males that offended and 30 females. These stats have been posted on the court's website, which is www.fljud13.org.
Repeat that
Any?
again, the website?
www.fljud13.org. Any questions?
I'll add that the number of 63 sounds rather flat without context, but it's high. We had the prior month we had 43, so we had 20 more instances, and it's actually almost a high. It's the 3rd highest number that we have since August. Maybe school letting out or something of that sort contributes it, because most of them were in school offenses. The community was lower than the school numbers. There were 34 in school and 29 in the community of the 63.
I do have a question. With the adding of the DV, of course, we can't see the future on how well the program will succeed. We believe that we have best practices in place and that'll be quite successful. But is there any plan to measure the recidivism specifically of our domestic violence youth that come through to make sure that we're being successful in what we're doing, or to see if we need to tweak the program to make it more successful?
In terms of recidivism, our program does measure 1 year after a client successfully completes the juvenile diversion program. We look to see if they are reoffending within that year, and we do capture those rates based on the actual offense, and so we will be paying special attention to those DV cases.
Thank you.
Okay, thank you.
Excellent. Nice job. Thank you. Okay, I already provided an update regarding Sins Fins. I'll briefly give you an update on some other activity that the board has been engaged in over the last couple of months since we last met in March. If you'll recall, at our March meeting, we had a discussion regarding a letter that Secretary Marstiller sent to me asking us to form a committee and looking at ways to better serve the dually served population of youth in our community. And so I have to report to you, I think hopefully everybody saw the preliminary report that I sent to the secretary, but we have done an enormous amount of work over the last 60 days. We've had some very robust and vigorous conversations around this topic, and we have come up with a general outline of some things that we feel could enhance the services to this population. And briefly, a brief background of the population is there's probably we estimate about 100 or so, 80 to 100 children in our community that are both involved in delinquency and dependency. Now, there's a smaller population of those children, about 30 or so, that are incredibly difficult to find services for on the dependency side. And it's primarily a result of their ungovernable behavior and the parents not being able to really discipline the children and the children obeying the rules and that type of thing. So they essentially get locked out of their home. But with that smaller population, they either have pending delinquency charges, which means that they're not adjudicated delinquent, so you can't engage them in any of the DJJ services, or they have previous adjudications which they're no longer on supervision for. So one of the main challenges is that there's currently no mechanism in place to order that child into any type of service. It's a voluntary type of process because they're pending adjudication, and the dependency system, believe it or not, does not have any mechanism where a judge can order the child into a particular type of service. So one of the first things that we've identified, and I would like to note for the record that Ms. Justice, as court administrator, has abstained from engaging in this part of the conversation, is as a group other than Ms. Justice's abstaining from that, which is completely understandable and 100% professional because she represents the courts. But we've identified that we need to ask the legislature to create some mechanism in Chapter 39 to allow a process by which community-based care organizations on the dependency side can petition the court for graduated types of placement that can be ordered by the court. And so that already exists in the SINS-FINS statute. However, these children typically can't be served through SINS-FINS because they can't have a pending delinquency or dependency case. So taking the same exact system that's available in SINS-FINS, which are a continuum of levels of care from community to staff secure to secure facilities, and incorporating that into Chapter 39 and asking the legislature to give the courts a mechanism and the community-based care agencies a mechanism to order these children into some type of care when they refuse services. The second issue that we've identified is that we believe we need to enhance prevention efforts, so really trying to identify these cases when the children are much smaller and before they get to be a 15-year-old who's locked out of their home and has prior adjudications on the delinquency side and is now a dependent child. So really identify those at a much earlier age and try to put interventions in place before it comes to that point. Training is another big issue that the folks that work with this population we feel need a extensive and intensive type of training module to be able to deal with their behavior issues. And then lastly, we really are interested in the community connections aspect of our board priority because we want to support that initiative so that the assessment center, there can be a door that these children can go to receive a standardized assessment to determine what their needs and treatment and protocol looks like, and attach a stabilization unit to that facility so that while the child is in crisis and is acting out and that type of thing, to really try and get them into a stable place where they can then go into a step up, step down type of system of care, and we identified that we need more step up, step down types of of facilities where they're based on acuity of the child, age, and gender, and that type of thing, so that the closer they are to the crisis, the smaller the setting and the more intensive the services, and then as they move closer to community-based care, it can be a larger setting and a less restrictive type of system. And then finally, the Blue Ribbon Commission is working also on increasing the professional foster parent pool and increasing foster parent training. And so we're going to support that effort and try to tie in their finished product in terms of foster parent training and recruitment into a final piece of what we suggest is that we really need a specialized population of foster parents to be available to work with this small population of children, because they have unique needs, and the foster parents also need to have unique training and unique abilities to be able to manage and work with them. So that's kind of where we are. We'll continue to meet probably every 2 weeks. I hope to have the final product prepared by the end of June. I really would like to wrap this up and get a final report to the secretary within the next month or so. So probably a few more meetings, and then some reviews of the final report, and then we'll see what the departments choose to do with the information that we provide to them. Mr. White.
You said about enhancing the prevention efforts. Were you referring to behavioral risk screening? You said early identification, Tim?
Yeah, it's really difficult to pinpoint exactly what the indicators are, right? Like, so you're trying to identify which children
might be at risk.
Should you escalate, right? So one of the things that we've determined could be a helpful thing is creating a checklist. So for even a child that goes to nursery school or, whatever, the people that are engaged with that child in the dependency system, to have a simple checklist that kind of captures certain indicators that their behavior may be getting worse or problematic. And so for the community-based care provider with their case manager, when they go and do their visit, as they check with other community members and engage with that child, that checklist can be a quick form that can kind of raise red flags.
Right.
But then we need to have a separate and more enhanced system of care so that when the caseworker identifies that this child's behavior is becoming problematic, that they can then refer that child to more intensive type of system of care to have more prevention efforts in place.
Gotcha. Okay. Yeah, the only reason I ask is because I think about the universal screening tools but I'm only familiar with two that are evidence-based. One is for substance abuse risk, that's SBIRT, and the other one is the patient health questionnaire, that's a very brief survey for depression screening. But some of those do ask questions and indicators about behavior that could be used and it's meant to be prevention and universally applied, not to those that are already in the high utilizer.
Right.
So I can share more about that. Thank you for that.
Yeah, and one of the things that we're really trying to avoid is trying to make recommendations that's going to put another task on the caseworker, right, that's in the system already, and, giving them another kind of thing to check off and that kind of thing. So we're trying to really figure out a way that we can have people provide input in a uniform and kind of standard fashion that could provide them after a quick review, some indication that some additional efforts are needed with that particular child, even though everything appears to be okay. There's some other indicators that warrant some investigation.
And so that does fit right in line with not adding extra work to caseworkers, because that is a type of screening that can be done universally. And a GED or a high school education person could do this evidence-based tool. But I can share more about that.
Yeah, if you can send that information to me, I'll share it with the committee, and we can talk about that more at length. But that would be very helpful.
And Elvin's done an excellent job of keeping us on task. It's a big committee, and it's complicated, and it's every 2 weeks, and he's really done a good job.
It's like herding cats, but thank you very much.
Good.
Okay, and so finally, under old business, we have discussed several months ago a juvenile justice progress report, and I have not had really an opportunity to pay much attention to that, but I left it on the agenda because it's something that I think we want to accomplish, and so we'll try to make some progress on that. Mr. Parkinson has volunteered to assist with that, and I don't know if you have any comments you want to share in regard to it or not. You don't have to.
There hasn't been any further developments from the last meeting. I've been out of town for close to 3 weeks, so.
Okay. So we'll keep that on the agenda and try and make some progress between now and July on that particular issue. Is there any other old business or new business? Okay, then we'll move on to our presentation portion of the agenda. And with that, I'd like to welcome Mr. Rob Phillips. He is the Vice President and Chief Clinical Officer of Phoenix House of Florida. And so Mr. Phillips is going to give us an overview and a presentation of the services offered. And Phoenix House has been a longstanding member of our community and an instrumental part of this board for a very long time. And so I'm very happy that you're here and want to welcome you.
Thank you very much. I'd like to thank everybody for inviting us here. I appreciate that everybody is willing to hear what we have to say. It's my job to either acquaint you or reacquaint you with what Phoenix House has been doing in your community recently. Does everybody hear me okay with the microphone? Yes. Okay, let me make sure I fix my screen here and we'll be good to go, guys. Why is this going the way it is? F5. F5, okay. F5. Perfect. Okay. And all I have to do is click this. Okay, so you guys see why I brought Samantha with me, right? Yeah. I want to tell you a little about Phoenix House. I can tell you all about our mission statement and what we do, but I want to make sure that you know the important parts of what we do and who we serve and how we serve. So I'll let you guys take an opportunity to read that. We certainly have an opportunity here to serve the public and to serve public health, and that's our main mission here. We're 30 years strong in the state of Florida. We have 2 locations. We have our location here in Brandon, which is in a lovely building, probably about 30 minutes east on that way. And we also have a 275-bed facility in Citra, Florida, which is a little bit north of Ocala. I don't expect anyone to know where that is, but it's in a lovely location. And we have 22 acres, and it's very nice to visit if you ever want to do that. 14,000 patients served and counting. 80-plus employees. I actually have a lot more employees than that right now because we're going through a big growth time. So we're growing, we're hiring. It's a good time to be Phoenix House right now and participate in our growth. 5 million people in the communities that we serve, that'd be just between here and our larger campus. We have the ability to serve much more than that and a much greater number of people than just the 5 million in our vicinity. So don't think that we're just going to cut it off at that. We have the Panhandle to serve. We have all the way South Florida to serve. We have other states to serve, and we're more than willing to do that. In this area, you can see where we're located. We're right in the middle of everything in Tampa. I lived in Tampa area when I was a little kid, probably about 5 years old. None of this was here then. And maybe I'm showing my age a little bit, but none of this was here then. Now Brandon is located in the middle of everything here, and we serve a large number of people. Particularly, we can see a large number of adolescents and high school age are well within driving distance from our Brandon facility. I want to tell you a little bit about our programs that we're offering right now, and that's in Brandon. There's a couple things about this that I want to point out to you that's very important to me, and I'm personally very passionate about. What you see about our services, we see a lot of services. You see probably a similar list of services to every provider that's going to come into the area and talk to you about this. We do outpatient, we do drug screenings, we do individual therapy, group therapy, but there's something I want to draw your attention to. We do seeking safety. Who's familiar with seeking safety? Okay, so everybody here should be familiar with seeking safety. Right before I came here to work for Phoenix House, I'm a pretty new employee. I've been here about 2 months, What I was doing, I worked in Southeast Florida, and my last project there was working with the children that were involved in the Marjorie Stoneman Douglas shooting. Okay, and what we noticed that, and what we did, the work we did there, was we noticed that the shooting happened and we had a lot of trauma, and we had people experience a lot of trauma. But if you watch the news now, you're seeing the effects of that trauma long term. I think we're up to 2 suicides of students that were from there, and a parent suicide from. So what you see when you experience trauma is that it isn't just the event. And one of the things we try to focus on at Phoenix House is, addressing that trauma, and making sure that that's given play to what's going on with the kid at the time, okay, or the adult. Okay, Derek Jeter Center. We're so proud to have a partner in Derek Jeter, and we have this lovely room, we have this lovely space, and we're able to hit a demographic of 17 to 24 years old. That's a weird demographic, right? That's not weird to everybody. Does anybody know why that's so important for us to hit that age group? Anybody that's ever worked in dependency, and anybody that's ever worked with chronically and persistently mentally ill children knows the day from 17 to 18 means nothing, is no different to me. Okay, I'm a 17-year-old one day, I'm an 18-year-old the next day. From the system, from the insurance companies, from our ability to provide treatment, you are a completely different person at that point. Okay, so it's our mission at Phoenix House not only to offer all these services we list here with the Derek Jeter Center, but to cater to that population. Anybody that's worked in foster care knows that you have a choice at that point. You can, I think extended foster care is still a thing, but sometimes you're out there, you're in the world. Okay, so we want to focus on that population. We're all able to offer medication-assisted treatment. We have 2 doctors that work with us, Dr. Martin and Dr. Gomez. Medication-assisted treatment, Vivitrol, Subutex, Suboxone. One thing that is important to remember about this type of treatment, it is peer-reviewed to be effective. Okay, and it is helpful in keeping people alive and keeping people clean from their addictions. Behavioral health is coming soon to our Brandon location. Of course, we have psychiatrists there, and we do some behavioral health interventions, but a full behavioral health service line is coming to our Brandon location. So it's going to give us not only opportunity to provide substance abuse treatment, behavioral health treatment, medication, and groups, and all those things to our Brandon location. So we're very excited about that growth. We're very excited about the ability to serve not only the substance abuse patients, but behavioral health patients as well in the very near future. We've been, like everyone here probably already knows, we have a long list of community partners and people we work with. Some of the partners I want to highlight here, Lyft. It's interesting that Lyft is one of the biggest partnerships that you'll see a lot of your hospitals and treatment programs accessing now, which is odd to me when I first understood that. But we have a large group of people that are barely insured, barely domiciled, and barely mobile. Okay, a ride to treatment can make all the difference for some people. A ride home from treatment can make all the difference to some people. So we're happy to count them as a partner. Continued community partners, Hillsborough County. Department of Corrections, we do a lot of work with the Department of Corrections, in particular in our Citra location. Volusia County Drug Court, United States Probation. There. More community partners. And clinical approach. I talked a little bit about our trauma-focused clinical approach earlier, and I'll let you go ahead and read this through. Make sure that we're always strength-based. I remember when I first started doing therapy as a therapist, and I maybe show my age a little bit here. It wasn't strength-based. It was a point at you. It was a point at you. Okay, what did you do? Now we build on someone's strengths and what a person can do. Every time you do an assessment, I remember the first time they put this in place, I used to work on a crisis unit, and you had to come up with a strength of everybody that admitted into a crisis unit. Sometimes the only strength was, well, this person's ambulatory. But we've been able to build on those things. We're looking to build on somebody's strengths, motivation, gender-specific. Gender-specific clinical approach is important in the world that we are in right now, in particular with kids in dependency and in particular with young adults. We have a lot of opportunity in offering a better wraparound service for gender-specific groups. Healthy masculinity is one of the things that we've been focusing on recently, but there's all kinds of options there and all kinds of things that we need to do work in, okay? Disease management, ASAM is what we do most of our criteria off of treatment. Anybody that's familiar with substance abuse is familiar with ASAM. If you ever work for an insurance company, you're familiar with the ASAM. The ASAM gives us an excellent guide for how to complete treatment and what level of treatment is appropriate for someone seeking it, okay? Or we offer co-occurring interventions. That means if you come in and you have a diagnosis of substance abuse, Anybody, if you work in this field for a long time, you know substance abuse usually isn't by itself, okay? You have somebody that has an addiction to cocaine, well, you find out, you get them in treatment, what do you know? They've had undiagnosed bipolar disorder for a very long time. I can give you a list of stories we have of adults and children that have came to see us with a substance abuse problem, and we sit down and we assess them, and they had an undiagnosed and untreated mental health condition. In particular, with adults, it's very, very sad when you come, somebody seeks treatment for the very first time, maybe my age or younger, and they say, wow, I never knew I had this. You know? And it's an eye-opener, it's an ability that we have to identify those things and help somebody out and give them that first opportunity for treatment. Okay. Let's talk, this is a good opportunity for me to brag on our program and Brandon, et cetera, a little bit. Our successful completion rate is above the benchmark for adults and right there with adolescents. We're very proud of that, but it's one of those things that I consider very much a moving target. So what is successful completion to us? Successful completion to us is that you've met your treatment plan goals and that you're walking out the door, somebody that's been compliant and completed treatment, okay? Successful completion to us is not, well, it's about time. I guess we'll get you out of here, okay? So we hold ourselves to a higher standard of that, okay? Client satisfaction. I always tell this story when I do training for all the new hires. 30, 40 years ago, if you went and got treatment or you went to the hospital, nobody cared about how your time was. They cared if you got better. You may get a nice nurse, you may get a mean nurse. You may get a nice counselor, you may get a mean counselor. It's not like that anymore. We're in a competitive environment, and we want to offer people the best interventions we possibly can. And you can see the evidence in what Phoenix House Brandon's been doing recently. In our adolescent program, we have 85% of our clients report being satisfied with their treatment. With adults, it is much, much higher. Okay, that speaks not only to programming, but the passion at which the people that approach the treatment. You know, I was just talking to Samantha on the way out here today, and how much the front door is just passionate about being kind to people and passionate about helping people, and it just sets a tone. And we're very, very proud of the work our clinicians are doing. Okay. This is a little bit of a more detailed breakdown of what our client satisfaction looks like for Brandon. One of the things that it really stood out to me here, and what I was particularly proud of, is involvement in treatment. And when we say involvement in treatment, that's it. You know, everybody is there. Everybody's taking place in treatment. It's for family, it's for the clinician, it's for the person that's receiving treatment. And we're very, very happy about that. Social connectedness is something that we're particularly working on right now. If you have, we do substance abuse treatment for adolescents and mental health treatment for adolescents in a way that the rest of the world isn't necessarily doing it. We take a approach on, what's the person doing, what's the family doing. We want to look more at what the community's doing. And I think that's why everybody's here. What's the community doing? How's the community supporting these things? How can this person get plugged into certain things that the community is going to continue their sobriety and continue their recovery? Okay. This is a little bit about Phoenix House. I have a lot more to say, as you can tell. I could probably take a lot of time and really bore you to tears. And I was told to keep it short when I came in here. But in all honesty, we are very passionate about what we do. We are happy to be in the community. We're happy to partner with everyone here. And we are getting good outcomes. We're taking very good care of our clients, and we would be happy to continue to do that in the community. Thank you all very much for your time. Thank you very much for the invitation, and I'll look forward to talking to you all very soon. Okay.
Thank you, Mr. Phillips. Appreciate that very much. Does anybody have any questions? Okay, Mr. White advises me that there's no one signed up for public comment. Any members of our audience wish to make any comment? Okay, do we have any announcements? Okay, well, seeing no further business, we'll stand adjourned. I hope everybody has a great summer and stay out of the heat. Thank you.